pay.
Should the government lower the cost of prescription drugs? When my son was in third grade, he was diagnosed with ADHD. When I went to pick up his prescription, I found that a 30-day supply of medication was not covered by my insurance, and I would be paying $250. Does that seem fair to you? Today I'm going to tell you about issues real people have obtaining high-priced medication and why the government should fight to stop large companies from skyrocketing their prices. I have done a lot of research and have found that many people have suffered from not having the monies to afford this medication and then resulting in poor health and even death. First, I'll tell you about the high-priced insulin issues, which is one of the largest and most common disease many people in America have. Second, I'll tell you about how the high cost can kill someone who can't afford their medication. And last, I'll tell you about what I have experienced with high-priced medication for my son. Let's talk about what effects high-priced medication can have on real people every day. Many people in America are insulin dependent. This could even be a close family member to you. According to Brand Sable-Smith from Kaiser Health News, an insulin steep price leads to deathly rationing. Nicole Smith-Holt lost her son to diabetic ketoacidosis 3 days before his payday because he couldn't afford insulin. Where do you get the extra money where you have exhausted all of your extra funds and you've asked your family for support and they have given all they can? Brand Sable-Smith from Kaiser Health News, an insulin steep price leads to deathly rationing, stated that roughly 1.25 million of us in the US with type 1 diabetes have to buy insulin at a pharmacy because our pancreases stopped producing it. In 2011, insulin's cost was $24.56 after insurance. Now it will cost more than $80 after insurance if you even have insurance. Many times your insurance deductible has to kick in first before the insurance will even start paying 1 cent for your health. Now I will tell you what I have learned about the high cost of prescription medications and why the government should fight to get the prices lowered. According to Nikki J. Matani in Doctor, high drug pricing kills patients. In medical school, they are never taught how to tell a deceased patient's family that their inability to afford medications is what caused a death. Matani also states neither does the Maryland Department of Health allow us to list inability to pay as a cause of death on death certificates. 1 in 4 Americans report difficulty affording prescription medications. Nikki J. Matani in Dr. High Drug Pricing Kills Patients says, yet the federal government, led by an administration heavily supported by PhRMA, the largest lobbying body representing pharmaceutical corporations in Washington, is doing little to tackle the issue. People are dying in a cruel way. No money, no prescriptions. The government should intervene in large pharmaceutical companies, but they do not, as they are not the ones suffering. Many people who die and go without are ones with no money at all. Imagine having a family member dependent on medication and seeing them suffer because the funds are not there. That is not the case in my world for myself and my son. Thankfully, we're able to afford the high-cost medication at $250 a month with insurance, which requires me to meet my $5,000 deductible before they will cover 80% of costs. What if I could not afford the medication? Then my son would suffer with this in his education. He would be unable to stay still and pay attention. I understand that not having this medication is not detrimental to him. However, it does not make the medication any less important than anyone else's. Who is really winning after all this medication is sold at a high cost? Only the government and large corporations who already have large tax cuts anyway. First, I told you about the high-priced insulin issues, which is one of the largest and most common diseases many people in America have. Second, I told you about how the high cost can kill someone who cannot afford their medication. And last, I told you about what I have experienced with high-priced medication for my son. The call to action. I hope that my speech will help you reach out to your government officials to ask them to stop these companies from skyrocketing medication costs to allow people to be able to afford medications to keep them healthy and alive. If someone in your family is going through a rough time trying to afford medication, help with what you can. Show them that they are not alone, especially when the illness is detrimental.